Hello everyone, welcome to the Briotix Health Spotlight, where we speak with providers, subject matter experts, and other key players in the field about the various aspects of worker wellness that are affecting you and your company today. Ergonomics, desk chairs, force gauges, and plenty of spreadsheets. The scientific side of ergonomics is often the focus of any program on paper. After all, to make a program or solution work, you need accurate information to work from. But what about when the information isn't measurable with the tools you have on hand? Today on the Spotlight, we're talking about the soft skills in ergonomics, the human factor, detailing the benefits and steps ergonomists can take to improve their work by developing a connection with the people they are working with. Joining us is Kristianne Egbert, Senior Corporate Ergonomist here at Briotix Health. Kristianne, thank you so much for joining us on the Spotlight today. Our discussion really wants to focus on the personal side of ergonomics. So looking at those soft skills that might be underutilized in some programs. So our first question is, what are some of the problems workplaces are facing today when we talk about implementing and utilizing ergonomic programs?
Well, I think there's probably a couple different avenues I could go with this, but if I'm going to keep it focusing on the soft skills side of it, I think that companies really, some, not all, tend to treat ergonomics like a check the box thing, something that we have to do. And because of that, it has check the box types of results, right? It might look good on paper, but is it really driving actionable change? Is it really creating a change in their culture? Is it really creating a safer work environment? I think that's probably one of the biggest issues.
Yeah. So looking at, creating that safer work environment, looking at these intentions that are going into an ergonomic program, what do ergonomic programs gain when you begin to implement things like soft skills?
Well, again, I think it creates a culture of safety and well-being, and it's a lot about building trust. And when employees feel like they're in a safe, trusted work environment, they're able to be more honest about their discomfort. That can help in a lot of different ways, right? Because it can help them want to drive change. It can help them want to use the equipment that's provided to them. It can help them be honest about the discomfort that they're feeling when they don't feel like they're at risk if they report it. And in doing that and kind of jumping in early, in terms of early discomfort, I think that's important. It helps you maybe not have the recordables. Ideally, we get to the point of true proactivity when employees feel safe and feel like they can take part in this program because it is available and allows them that improved communication.
When you're looking at, topics like improved communication, making employees feel more comfortable, what's your approach to get into that layer beyond, you've just been introduced to the workplace, management has started this conversation about improving safety, improving what the workplace looks like. How do you move from this, theoretical numbers goal to talking to that person in the workplace, getting them involved in the ergonomic process?
I think it starts with active listening, right? And maybe even before that, helping people understand the why. Why you're there. A lot of times we'll walk in and you get people kind of crossing their arms and they're not really wanting to open up. But in starting to ask those questions and really pausing and listening to their answers and not trying to jump in with, well, all you have to do is this, or what you ought to do is, right? You're not jumping in with solutions. You're just listening. And I think that goes a long way. Also, just kind of standing back and watching, observing their behaviors, understanding the context of why they're working the way that they're working. And again, asking those questions, not why are you doing it that way, but, oh, help me understand what's happening here. I noticed this. Help walk me through that. And oftentimes they give you really good reasons why they're working in this really awkward position that maybe you wouldn't have understood if you were just standing there watching it, just standing there, filling out a risk assessment form. Because in asking those questions, it helps you understand what you need to do to be able to change it. But you have to start with asking those questions and not just asking them, but listening to the answers and giving them the chance to be able to get to the why.
I feel like we've really been hitting on the analysis portion of this piece. When when the ergonomist is in the workplace, when they are creating those initial plans, trying to understand the why, for a provider who is there every day and is seeing, the little things, the in-between moments, how do you recommend implementing some of these kinds of soft skills, these easy approaches into daily routines, or getting that information in a more succinct way than, let's say, going through the routines of a provider's daily check-throughs? How do you recommend getting these soft skills, these conversations into all the tasks that providers and ergonomists themselves are asked to do when a site is launching or in those daily repetitions that are going on?
Honestly, I think it's all about the follow-up, right? It's showing up, it's being there. It's, oh, this person's back. Oh, they're not going anywhere, are they? Right? Helping them know that like this isn't just oh, it's safety week and we're doing ergonomics this week. It's not that, right? And the best part of being on site and having the ability to consistently work with people is they know you're just going to keep showing up and this really isn't going anywhere. It shows that you're invested. And I think at that point, it takes it from that check the box, we're doing ergonomics this week, to an investment that this is a conversation that's going to continue and it's not going anywhere.
Yeah, that conversation of just check the box to actual care, I think is really the difference maker from conversations I've had with providers, with ergonomists, our subject matter experts here at Briotix Health. It's finding, that next step beyond that really improves care. When did you first see the value of focusing on the approach when meeting new clients or employees?
You know, the whole reason I went into ergonomics and human factors engineering was because of the people side of it. When I was a kid, my dad would say, "Oh, you would be a great engineer." He's a mechanical engineer at NASA, and I was like, I am not that person. Like, I can't just be sitting behind a desk all the time. I want the people side of it. And honestly, it was my advisor when I was at Ohio State University that had introduced this concept of human factors engineering to me. So I think for me, it was very, very early on. The the realization that not everybody knew this probably came quite a bit later in my career when I was kind of sitting back and trying to understand. Actually, one of them was I was back at a client site that I hadn't been to in probably 5 years. And they had me back and I was doing ergonomic assessments again. And as I was there and kind of collecting data and talking to the operators, they were like, "Oh, yeah, we've done ergonomics before. They had somebody out here probably 5 years ago. And do you want to know what changed? Nothing." And I was like, "Oh, yeah, that was me. It was me that was here 5 years ago. And I know that some things have changed. Tell me about this tool that they implemented." And they were like, "Oh, that, yeah, it's sitting over here in the corner." Oh, well, did it not help? Well, I mean, it did, but it also kind of made things harder. And here's why it didn't work. And it was missing that follow-up that we just talked about. And it's not just the follow-up, it was missing the inclusion of the people who are going to be using that tool from the very beginning, right? And so by realizing that there was that gap, it's just kind of in my head. And then you see, I kind of started to see a trend over and over again. And it was when ergonomics programs weren't participatory that there was a problem. It was when ergonomics programs didn't have the follow-up that there was a problem. When the frontline workers who are most affected by these programs weren't included in that process or didn't understand the why we were having an ergonomics program to begin with, those are the programs that didn't work. And it dawned on me that, wow, people just aren't communicating this, or maybe they're communicating it, but maybe not in the most effective way. And that kind of putting all of that together is what made me think, wow, this is a real problem. And I didn't see it, right? Because for me, being the people person, I think it just kind of was a natural connection, but it's one that's often missing.
when we're seeing these implementations of new tasks, changes to responsibilities, changes to job tasks or tools, there's obviously like a slight burden that's involved with those, right? Just a mental shift that can be something that employees are reticent to really jump on. Do you see kind of a shift towards more thoughtfulness or inclusions of behavioral health aspects in ergonomics programs with the importance of these soft skills?
Do I see it or should I see it? Are probably two different questions. Um, I think as a culture, we're becoming more aware. And so, yes, I do see it. And I think it's going to continue to get better with time. Again, the realization that you're taking somebody that has done this job for 30 years and suddenly you're like, hey, try this new tool. And it's going to be one side or the other. They might be like, oh, yeah, this is great. Finally, you understand how difficult this is for me. And they might really jump in and think it's a great idea. Or it could be the weight could be different of like, oh, they think I need this help. Maybe it's because I'm aging, or the soft skills tied directly into that. And again, helping people be a part of that solution. Hey, here's this issue that we're noticing. How can you help us with this? Again, I think the behavioral health aspect of that helps them feel like they are part of the solution, and it helps drive that change. Soft skills ultimately turns a service or an ergonomics program or the implementation of those changes into a partnership so that it creates that change together versus having change created to them.
Do you see soft skills as an advertising point for ergonomics in the future, as one company really excels in this point, or do you see this as something that's going to be in the background? Do you see a rise in this topic in the world of ergonomics?
I don't think so. I mean, I think it's something that should be talked about, but I don't think it's an advertising point or anything like that, right? Like, it's just something that it should be a noted part of an ergonomics program. But how do you have a hard time teaching soft skills, right? That it's just you learn by doing and practicing, but helping people realize that the inclusion and kind of the cross section of people that are part of your ergonomics program are what's going to make that change. I think that's really what it boils down to.
Kristianne, thank you so much for joining us to talk a little bit about soft skills and ergonomics, finding that personal side, and improving ergonomics programs for the better.
Thanks for having me.